everybody, Ann Pauley again for a new little assessment tip that's very efficient. And today we're going to learn how to assess the bony landmarks of the hips. And the reason why we do that is to see if the hips are anteriorly rotated or posteriorly rotated. So when the pelvis is out of alignment, so will be the rest of the body. So an easy, quick way to assess to see where your client is, so you can know what muscles to affect so they can feel a little bit better, get out of pain, maybe a little discomfort, and improve their posture along the way. So let's first start with the anterior rotation. So to find we're going to look for the Psis, the posterior superior iliac spine. So the easiest way to do that is to grab the person behind them, like just grab their hips right there, and you'll feel these little bony protuberances, and that is your Psis, your posterior superior iliac spine. So then you take the finger, one finger, and hold the one side that you want to assess, and then if you'll raise your elbow up, this is Shalane, my partner, by the way, my wonderful demo. So now we're going to find the Asis, anterior superior iliac spine. So you'll find the front of the hip bone here, and there'll be like a little curve, like a little lip, and you're going to have your finger right there on that little protuberance as well. So then you come down here, and you can see, if I straighten my fingers out, that this is lower than this. So this Psis is higher than this anterior superior iliac spine. So on women, if it's lower, if the anterior superior iliac spine is lower than a ½ an inch, that means we have an anterior rotation. So guess what? She has an anterior rotation. You see that? So that means this hip is rolled forward here. Okay, so what muscles would create an anterior rotation? We've got quads, adductors, we've got psoas, which plays a part in a lower abdominal. A lower psoas attachment might be tight. Now, just because this hip is anterior, it might not be the same on the other side. So we want to have her turn around. We're going to find that Psis. So we again grab the hip here, not grab, just put your hands on her hip. Find that protuberance. Now we've got the Psis for this side. Come down, find that Asis, and here we go. Straighten the fingers, and we have a bilateral anterior rotation of the hip. So that means her quads are tight, her adductors are tight, and possibly her psoas attachment is tight. So when the pelvis is rolled forward, it could create low back pain. The lats could also play a part in that. If they're locked down, they could pull up. So there's all kinds of different factors involved here, but at least you know where to look to start, right? To get familiar with how the muscles play out in the body. So that's the anterior rotation assessment. Now, if her Psis was low, let's say her Asis was up here, she's trying to emulate that, but that's pretty impossible. But if her Asis is higher than her Psis, then we have a posterior rotation of the hip. And so that would include like hamstrings, glutes, and then the upper abdominals might be tight as well. So we've got anterior that rolls the hips forward, posterior that tucks the hips under. So those two imbalances can really create havoc throughout the body. Now for the third and final assessment of the hips, you want to find those Psises again. We're going to look for an upslip. And what that is when an ilium jams up onto the sacrum. It just jams up there, and you won't have the range of motion in the hip that way. You won't have that movement because the ilium is supposed to move freely from the sacrum. Just a little bit of range of motion there. But if this is jammed on the sacrum, now we have a problem. So we're not getting the movement here, and this was overdoing it. So you may have all kinds of problems in the back, hips, down the legs, things like that. So we don't need that, right? So to find an upslip, you grab the Psis here again, find those little nodules, and then you're going to have your client bend over. Keep the thumbs on the Psis, then have them stand back up. Now, if, let's say, the right one was higher than the left one, that means that we have an upslip on this side. That means this ilium is jammed on that sacrum. The muscles involved in that could be iliacus or the iliopsoas juncture. So, there's some more information for you to quickly determine what you can do to help your clients. I hope you like this. Please use these assessments. They're very important for your career if you're a clinical therapist. And subscribe to my page. Give me a comment. Let me know what you think. Thanks.